Dear students, the topic of our lesson for today is breastfeeding. I am Ganiva Shahzoda Shavkat and I'm the Associate Professor of Number 2 Pediatrics Department of Bukhara State Medical Institute. Let's begin our lesson. Breastfeeding is a natural process that replaces pregnancy and childbirth. Breastfeeding fully replaces all the basic needs of the child and breast milk contains an optimal ratio of proteins, fats, vitamins, more than 15 hormones, lactobacills, growth and development factors. Mother's milk is rich in antibodies that protect baby from some infectious disease. Breast milk changes its composition depending on the needs of the child at the moment. Breastfeeding helps a woman recover faster after giving birth, and breastfeeding strengthens the maternal instinct and does not require any financial expenses. In this slide, you can see breast anatomy and structure. Oxytocin makes muscle cells to contract. Here you can see muscle cells, and here you can see little milk secreting cells. Prolactin makes them secrete milk. Ducts, lactiferous sinuses. This dark side is nipple. Every time milk collects in lactiferous sinuses, Montgomery glands, which are pair glands secreting antiseptic fluid, alveolus, and supporting tissue and fat. In this slide, you can see the let-down reflex. Hypothalamus, the area of the brain that produces oxytocin. Pituitary gland, the area of the brain which produces prolactin and releases hormones into the bloodstream. When baby sucks at the breast, tiny nerves are stimulated in the nipple that send a message to the brain to become synthetic milk. Prolactin is a hormone that causes the breast to produce milk. Oxytocin, a hormone that causes the let-down reflex, causing the breast to push out the milk. This is the oxytocin reflex, which works before or during feed to make milk flow down. When baby sucks, oxytocin will be synthesizing into blood and milk will be ejected. The second side of oxytocin is making uterus to contract and helping for women to recover faster after giving birth. Breast milk cannot be produced indefinitely, so it has some stopping hormones like inhibitors in breast milk. If breast remains full of milk, secretion stops. There are some principles of successful breastfeeding which are conducted by World Health Organization and UNICEF, provides a list of factors on which successful breastfeeding is based. First is early attachment to the breast within the first hour after birth. The second is lack of additional feeding of the newborn. The third is joint stay of mother and child after birth. Proper attachment of the baby onto the breast, which will ensure effective sucking and comfort of the mother. Feeding on demand. The duration of feeding is regulated every time by the child. Nighttime breastfeeding is very important for good milk production. A baby who is exclusively breastfed does not need additional water. Breast milk consists of 87 to 90% of water. The breast does not require frequent washing because of Montgomery glands which are synthesizing some antiseptic fluid. Only breastfeeding up to 6 months, the child does not need additional nutrition and complementary food for up to 6 months old and continue breastfeeding up to 2 years old. In this slide, you can see the rules of how to attach baby onto breast. Hold baby close to breast within their nose level with on the nipple. Let baby's head tip back a little so that their top lip can brush against nipple. This should help baby to make a wide open mouth. With baby's chin firmly touching breast and their nose clear, their mouth should be wide open. When they attach breast, you should see much more of the darker nipple skin above baby's top lip than below their bottom lip. Baby's cheek will look full and rounded as they fed. In this slide, you can see and compare poor attachment with optimal attachment. In poor attachment, baby has nipple in mouth only and is unable to suck properly. In optimal attachment, baby has nipple and most of areola in his mouth, and there are junction of hard and soft palates. And there are some feeding reflexes for babies, which are skill for mother, learn to position baby, and for baby, learn to take a breast. This is a rooting reflex, first reflex. When something touches lips, baby opens mouth, puts tongue down and forward. Sucking reflex. When something touches palates, baby sucks. Swallowing reflex. When mouth fills with milk, baby swallows. And gag reflex. When something touches anterior parts of the tongue, baby pushes it out. Here is the most common feeding position. The first is cradle. The mother sits down and takes the baby so that his head is on the elbow band. Here you can see she turns it to her tummy and gives it a breast. The second position is reverse cradle. This type of cradle position will help the child to correctly capture the breast in the first days after birth. This situation is especially convenient in the case of premature or small babies. This is the third position, lying on your side. Most often this position is used during night feeding. Mother and baby are lying on their sides and facing each other. Here you can see they are facing each other and they're relaxing. And relaxed position itself. The child is lying on the mother who helps him find the breast and attach it. In addition to the fact that the mother herself is relaxed, this position protects and perfectly calms the baby himself. In this picture, you can see nutrition of a newborn baby and the kinds of milks which are changing every day. From the moment of birth until about 3-5 days after, the baby will receive colostrum. Colostrum is yellowish and it is small in quantity and composition, which fully correspond to the nutritional needs of the baby. Because on the first days, the stomach of babies are very small, so that's why they don't need much more milk, but they need more nutritional feed. And we'll talk about some harmful effects of formula milk, of course. When we compare mother's milk with formula milk, of course, mother's milk has many benefits. Formula milk for 3-day-old babies is no different than formula milk for 3-month-old infant. It changes only on 6 months. Every 6 months you can take another formula milk, but mother's milk changes every single day. Breast milk is ingeniously different every single day, adapted to the changing needs of the baby. So that's why breastfeeding is best feeding for babies. And of course, human milk is designed to support the development of large brains, capable of processing and storing lots of information. But cow's milk is designed only to support functions like constant grazing. And it will be successful when breastfeeding will be successful if the mother feels good, of course. It's the first convenient issue. The baby is properly attached to the breast, which allows it to suck effectively. The baby sucks as often for as long as he wants. So it means breastfeeding on demand. The environment is conducive to breastfeeding. So environment is our family. When our family helps us to breastfeed, and in some householding chores, for women there will be much more time for effective breastfeeding, of course. And there are four signs that you have to know if you want to estimate is it enough breast milk or no. First of all, it is swallowing. If baby is swallowing, it means there is milk coming out of the breast. The second is weight gain. After some weight loss in the first few days, you know that on the first days of life, babies have physiologically loss of weight for up to 10%. For example, if baby is born with 3,000 grams, he will lose 10%. It will be 2,700 grams, at least, at minimum. And after some weight loss in the first few days, baby should be gaining weight steadily along the curves of the World Health Organization growth chart. You know the growth chart because by the growth chart there are normal weight gains. And the big picture, baby should be generally healthy looking, content at least some of the time, alert, meeting developmental milestones and growing too big for his clothes. For example, mothers know that the clothes will be little for their babies, so that's why they are growing up. And by diapers, what goes in must come out. After the first week, looking for at least three dirty and five, six wet diapers a day. 5, 6 wet diapers a day, it's enough. It means that baby taking enough milk. If all these things are true, you don't need to worry about your milk supply. And every time we have to explain these rules for mothers when they come to talk about this problem. When a baby gains weight slowly, most newborn babies lose weight. They return to their birth weight when they are around 2 weeks old, for example. Gaining weight slowly can mean your baby is unwell. Maybe he has some disease or isn't getting enough milk to grow. A healthy baby should gain weight as follows: 2 weeks to 4 months old, by 125 to 200 grams, 5 to 8 ounces a week. 4 to 6 months old, from 50 to 150 grams a week. And then after 6 months to 12 months old, from 25 to 75 grams a week. So that means that every week we have to check the weight of our babies. At the end, I want to say that there is no freedom of choice of humans if it has been taken away from them at the beginning. Breastfeeding is not a choice, but an obligation to the choice. Give your child the freedom of choice and give nature